Hello, everyone. Hi to all our lupus warriors and fibromyalgia warriors. Welcome to a very special edition of Community Connect with our good friends, Looms for Lupus. I'm Melissa Talwar. I'm the executive director of the Support Fibromyalgia Network, and I'm a board-certified functional medicine health coach. And I'd like to introduce Juana. Juana, why don't you introduce yourself?
Good morning, everyone. My name is Juana Mata. I am one of the co-founders of Looms for Lupus. And Looms for Lupus is a nonprofit organization where we help lupus patients, caregivers, and loved ones with resources, information about lupus.
Well, I'm so glad we always team up to do this because we always have such great conversations and we're like, okay, well, maybe let's take this to the public and our community a little bit more and engage them. Shout out to Estella. She is honoring her body and could not make it today. So we miss you and please feel better soon. But we thought that this was an important conversation to have with our community and just checking in with everyone on kind of where we are at with COVID-19 as far as our communities go when it comes to the chronic illness communities and fibromyalgia and lupus, because we've been getting a lot of questions coming in, questions, concerns, confusion. So we thought we would just do some check-ins with all of you and let you also ask questions and have sort of a roundtable open discussion as we move forward. So if you're tuning in live, just give us a shout out. Let us know where you're tuning in from. Please like and share this content, like the pages for Looms for Lupus and Support Fibromyalgia, and connect with us. But we're going to get started with I guess, just a lot of what we've kind of noticed. I mean, have you seen a lot of questions coming in, Juana, about any particular top level questions? Or is it just concerns for the lupus community?
I think it's not only questions that we're getting, but also concerns as to the COVID vaccine, about whether we should take it or is it okay for us to take it. So yeah, there's questions and concerns, and if we do take it, how is it going to affect us living with lupus or with other autoimmune conditions? So there's a lot of questions. There's a lot of information that we still need to provide or need to get from doctors about, how we can make the best decision as to whether to get the vaccine or not to get the vaccine.
I noticed that that's a big question for the community, and especially with lupus and other autoimmune conditions. I know with fibromyalgia it might be a little bit different, but I mean, providers, you're working with your provider to try to make the best informed decision for yourself. And I'm hearing that there's both a struggle in just getting the information to the providers, like accurate information. It kind of seems to be blanketed, but there is some concern on like what to do. So I think that's why we wanted to break this down for everyone and kind of maybe start with a little bit about the Delta variant and some of the resources are there, and then go into some of the vaccine type things. I know we kind of have to change our descriptions around because sometimes in social media, they don't like us talking about specific stuff. Just as a disclaimer to everyone out there, we are not medical professionals. We want to open this up to have a good discussion with our community and patient community. We've provided links in the description that are more educational based to link you to the more information that you can find. You can take this to your provider, make an informed decision with your provider when it comes to these topics. But at least we can have an open discussion with all of you as patients, patient advocates for our community moving forward. But I know a lot of the discussion is like you hear the Delta variant, right? Juana, like it's all over the place when it comes to that. Do you feel like we're getting good quality information with what it is or what's going on, or do you think it's confusing people even more?
In my opinion, as Melissa said, we are not doctors. We're just patient advocates that, we want to share information, the little information that we have. And in my opinion, I think that there's still a lot of missing information. I think that we still need to get more information and information so that all of us can make decisions. So definitely, I really believe that more information is needed for us to make the correct decisions as to whether to get the vaccines or as to the Delta variant. So yeah, definitely we need more information.
Well, and one thing I've noticed for our community is especially like you see like mainstream media and what they're like covering and all that, and even that's confusing. And so I get frustrated for people because the messaging isn't really clear cut. Like this is what's going on, this is what needs to happen, and here's like stuff that you need to like think about and really succinct language. So even I get frustrated with what I'm hearing as far as the language goes, but I'm noticing too, like even for our chronic illness communities, a lot of the resources haven't been updated. So they got put up on like 2020, and now we're in a whole new year and we're dealing with a whole new variant that looks very different.
Mhm.
And these resources aren't necessarily up to date. Like it's still on basis of the research of like the alpha variant or the ancestral variant that started. So that's why I just get a little bit frustrated, because I was like, everybody needs more information because there was less of an impact then, but now like bringing in what we're talking about with the Delta variant, what's new, and just understanding of it. So we wanted to like, I mean, if anyone out there is also confused on the variant, please just share with us like any confusion and stuff. And I'm going to pull up a quick slide, and we included this link for the CDC, and I'll try to capture the link as well when it comes to the document. I don't know why they called this the leaked document, but it sounds like Estella was on the call with the CDC when they showed this PowerPoint. I guess they weren't prepared to share the PowerPoint with everyone. Maybe that was it. So someone sent it out to the public or the Washington Post. But this is kind of what we're referring to. So I posted the link in the discussion if anyone's interested in pulling it up. But we're going to kind of reference the Delta variant when we share our screen. In just the transmission rate. So this was the one screenshot from the CDC deck that really, I guess, was important for people to know of these new differences when it came to the Delta variant and understanding the strain. So the virus has changed. So this is kind of where the confusion has come from. And we've heard this from public health. I kind of wish that they would give us more direct information, but this chart shows the increase in transmission rate of how it's moved onto the scale. So I thought it was just important to show everyone the visual from this CDC deck of what's going on with this particular Delta variant and where it lies with other transmissible like infectious diseases. Because you can see its impact. There's a slight movement up the axis too, so we don't want it to get more dense when it comes to other things as well, and then more transmissible. So it is become noted that it looks like it's much more transmissible. It has an increase of viral load, which is affecting more people. And this is kind of where it goes back to our questions that we're not getting answered from the autoimmune chronic illness community. It's that increase in viral load, no matter if you're vaccinated, how is that going to affect autoimmune conditions? Because there is such an increase in viral load to us. And there is some hypothesis that it actually can decrease the immune system's response. Like it might bypass that for a few, and that's how it gets in and increases the viral load. So I just wanted to reference this really quick for all of us to kind of understand what type of variant and where we're going when people talk about increase in transmission, more of the viral load. So when people talk about protecting yourself or decreasing viral load, this is what they're referring to when it comes to that. Does this make sense to some of the communities, you think, Juana, or do you think we need to break it down even more?
I think we need to break it down a little more. But I also wanted just to read a message from Rosemary Rojas. And I know that we're talking about this variant, but I'll read the message, Melissa, and I'll tell you what she's saying. She says, one of my main concerns is that a doctor told me that vaccines for COVID-19 are giving a lot of patients false positives on some important tests. So because I am getting ready to do hip surgery, I'll do that now. If I should do, I'm getting ready to do hip surgery, I'll do that now. If I should do this vaccine yet, but then I'm scared about the Delta variant. What would you say to this, Melissa? I really believe that, Rosemary should, read a little bit more and talk to other doctors so that they can give you a little more information as to, if giving a false positive, is that going to prevent you from getting the surgery? or what can happen. So I think it's important for you to maybe consult with another doctor so that you can make the right decision as to getting the vaccine or not. I personally, I can tell you, I was from the beginning, I was diagnosed with COVID back in November. So learning and knowing everything about what the CDC and information that I gathered from my doctors and from different resources, I made the decision of getting the vaccine because I knew that when I had COVID, I didn't know whether I was going to make it or not. So it was really scary. I've had family members who have passed away from COVID, and my understanding was and is still that if you don't get the vaccine, you do have the risk of getting a really bad COVID or complications. But so if you don't get it, you could possibly even get those complications and even pass away. But if you do get COVID, the symptoms are going to be reduced. With having an autoimmune, I had to really think about it and my decision, as everyone should have their own decision, whether to get it or not. My decision was to get it. I feel comfortable. I feel better because I'm not only protecting myself, in my opinion, but I'm also protecting my loved ones. So for me, it was very important to get it. Now, for you, Rosemary, because you are going through surgery, I think that maybe consulting with your doctor and just gathering more information as to whether you should or you shouldn't.
Well, it looks like too, her question comes in because she clarified it, was that she has two conflicting doctor comments. Yeah. So one doctor is telling her she should get it before the surgery. Another doctor is she should wait. So I think this is what we're running into, is doctors are telling different information too. So how can we make the best informed decision? And I mean, so Rosemary, we put some documents there that you can do some more research with to see what works best for you. But this is very tough because one doctor is going against the other. So I can understand how this could be extremely frustrating and confusing for you when it comes to that. I would say though, because of our experience with all of us, of what we did experience. Well, Juana, when you took the vaccine, did you experience any of were you sleepy or have those effects afterwards?
Yeah, well, the first vaccine I did, I only got pain on my arm. Other than that, I didn't have any other symptoms. But the second vaccine I did had fevers for about 2 days, the pain, the fatigue, or I just needed to rest. So I was okay after that. Now with COVID, it was a totally different thing. I still believe that I still have the long haul effects of COVID. And I've known a lot of people who are also struggling with that. So you have to wait. And I think, just making the informed decision as to whether to get it or not. But yeah, with the vaccine, I didn't really get bad symptoms. With COVID, I did. And I still have those symptoms, or the long haul effects of COVID.
I mean, I definitely, for anyone out there, and we can get into more details on some of the information that we posted about vaccines in itself, is moving ahead with that. If you do end up getting it, Rosemary, especially, give enough time to lapse for yourself to make sure your immune system is stable enough before you go into surgery. Just because a lot of us have seen some immune response. So just to let everybody know, I did take the J&J vaccine back in March, and boy, did that really rock my system. So with a lot of chronic pain, a lot of brain fog, I feel like my hormones kind of shifted around and are still trying to adjust for the immune response that I had. But I was plastered to the bed in a lot of pain that I hadn't had in a very long time. For almost 3 days, and the brain fog took a few months for me to really get back after that. But I was having a lot of brain fog issues. And that was with the J&J. So that's why I'm saying, if you do move forward, for anyone moving forward, just give yourself some break in there and understanding and forgiveness where you prepare for this, because these are tough decisions, and it's really tough. And I wish someone would give our communities a little bit more concrete besides just, you should get the vaccine. And then they kind of leave it at that, because it is confusing for whether or not we build antibodies. And we've heard from people in the community who were part of the Johns Hopkins study and they didn't build up antibodies. And then there's also people who just can't get the vaccine because of their medical conditions. So what do, as a community, with those breakdowns of people who have not built up the antibodies, people who cannot get the vaccine, what is their approach to all of this? Because we know the impact of COVID-19. We know that we'll get more of a severe response with COVID-19. And that was the goal of the vaccine, to decrease severity of COVID within our communities. So,
Right.
I mean,
and unfortunately, Melissa, we also have been hearing about those people who have received or who have had the vaccine and who are also experiencing other problems due to getting the vaccine. So, yeah, there's still a lot of information that needs to be given to us. There's still maybe a lot of research that needs to be done as far as, for all of us to make the right decisions. Unfortunately, there has been also patients who are also having those issues after the vaccine.
and I mean, it's hard because it does rev up your immune system. I mean, that's the whole point of it. So when you have autoimmune conditions or just a very overreactive immune system in general. So I think what we need to really give people tools out there, and that's why I request from some of these organizations, really give people some extra tools on how they can prepare for it. Because I think we're getting a lot of questions too from people with lupus, like, what do you do if you're in a flare currently? Like, should you go get the vaccine? And your inflammation numbers are really high right now, and what that looks like. And again, we keep saying to go back to your providers and have this discussion, because we can't make the decision for people. But when the providers are confused and they're trying to relay, and they don't mean to be, but I mean, if you look at the information and how it's coming down from the top, it's very confusing. So
Right.
who's supposed to understand this?
Right. So what Rosemary's saying, that her primary doctor is recommending the vaccine, yet her surgeon is the one that's telling her to hold off, and because the vaccine flares up the lymph nodes.
Right.
And unfortunately, that could happen. I don't think it's happening to everyone, but it could happen to certain patients. And I mean, who knows if it's going to happen to me or to you. So definitely you do need to do a little bit more research for you, Rosemary, and make your decision as to whether you should or you shouldn't.
I know. I mean, I wish we could tell people the straight answers, but it's like we don't have enough information to know how everyone reacts. Because we also included a study from, it was a survey. Like a lot of the information we have on reactions to COVID-19 vaccines are from surveys. So this is requiring people to put in their own responses and their own experiences. Mm-hmm. So we included one from Health Rising, which includes the chronic fatigue, like ME/CFS communities, fibromyalgia. So Health Rising kind of broke down the experience from the different vaccines from that community. And you can see there's kind of a 3-month of still feeling the effects, especially for the ME/CFS community. But then I know Lupus.org, we posted a link to that, where you can kind of see some of that information of the COVID-19 vaccine information. So it says it's well tolerated, but I think we dug into this information a little bit more. So we offered that study if some people want to read it too. But I'd like to preference, when you look at it, and it's no real knock to anyone else, it's just understanding what's going on here, is one thing we noticed is there was a lack of ethnicity, like diversity in the studies. And then also, I think it was the United States is only 8% as part of this survey. So a lot of this was European countries that they surveyed. So we kind of have to understand what's going on. We have different healthcare systems. Mm-hmm. People might have responded differently because of the healthcare systems. I mean, you can't have universal healthcare and compare it to like what we have in the United States and people's opportunities and how they got the survey, how they knew about the survey. So I think we need to I just ask people to do better jobs when it comes to these surveys, because it is based on survey. I don't know, like, how would, I mean, with Juana, if someone sent you a survey, like, how would you feel taking it? Do you think you would give enough accurate information if you're in the moment of filling it out, like with your brain fog and all this stuff?
Right, absolutely. I don't think 100 the information would be 100% accurate. And why? Because like you said, the fog, the lupus fog, now even with COVID fog. So I guess it would be depending on the day that I was to complete it. If it was a day where I was going through a lot of fog, then I could probably not remember everything about it, or about what I'm answering, or even the day that I was taking it, if my pain levels were high, or anything could change the answers, I think.
Well, and that's why it's interesting too, if we really wanted to get accurate measurements from people when it came to surveys, is to start from the beginning. Like, if you've been diagnosed with lupus, where are you in your stage of lupus? Like, what were your current symptoms? And then you go and receive the vaccine. How do you feel? Like, try to document it as much as you can, write it down, just, either use your phone or a pen and paper, and then you continue to document as you go through. And that's kind of the best way to see what's going on, especially changes. We can't necessarily send you for constant lab tests right now, but at least symptom wise, you can kind of track that. So it'd be interesting. If anyone wants to do that, that might be something to do. It's like, if you know your lab values are this at the beginning and you feel a certain way, like maybe you are feeling like pretty good with your lupus at this point in time. And then you can move through, note when you get the first vaccine, or note when you get one of the vaccines, and then just start documenting how you feel.
Right. And that would be important. Maybe making sure that, that you keep a journal before and after, so that, again, lupus fog, and because a lot of the times we don't remember what happened a day or 2 days ago. So maybe having a journal, I mean, if you're going to be making the decision of getting it, having that journal, that way you know exactly how your body is reacting, or how the body will react after the vaccine.
Yeah, and I mean, the great thing too with even audio on the phone is you can do audio notes. So if you're not feeling like writing it down, you can do a whole audio diary. I'm hoping this also helps and translates it too, in case you have to go to your provider later, if you're still having like long lasting symptoms, because I'm not sure if there's a lot of dismissal going on with what's happening with either getting infected with COVID-19 in our communities or getting the vaccine, like these longer lasting symptoms, and it's just your fibro flaring, or, it's a lupus flare. And are we getting enough accurate information within that, because it kind of gets dismissed or put under the diagnosis that we have?
Right. And example for me, I had the COVID. Well, I have lupus. I had the COVID, and I had the COVID vaccine. So a lot of the times, like, okay, where is this pain coming from? Is it from lupus, COVID, or the vaccine? So yeah, it could get a little confusing and frustrating at times.
Well, and we have to be honest when it comes to, like, this is related to the immune system. So all of this is immune system related. I mean, just getting infected with COVID-19, getting the vaccine. So it's all revved up and it comes to that. So having people understand that and relate to that is something that's important for us to understand too. And one of the documents we wanted to include here was just if you are deciding and thinking about getting the vaccine, is maybe preparing with your doctor in advance, especially for some of those lab values that we've kind of seen discussed in when it comes to COVID-19 prevention. And also it'll help with the vaccines. One of those things is like vitamin D levels. So if you're super low, maybe try prepping with your doctor a couple weeks in advance, or even before you get the vaccine, so you have some of these lab values a little bit, especially nutrition wise, a little bit like higher than what you are going with now. Because I've kind of seen that with some people that ask questions, is they have the really high inflammation values for lupus, but then you see what the vitamin D is at, and it's actually at the really super low end So we're talking about 20s or even 30s. Like, I think this is the discussion to really have with your provider, because we've seen better results for autoimmune conditions when it's higher.
Mm-hmm.
And to see what that takes maybe before you even start this process. And it'll also be good preventative measures for infections of COVID-19, because they see that that's some studies have kind of seen factors with the vitamin D levels. So we also just included this, it's a functional medicine pandemic pre-vaccine protocol to kind of just go through and maybe just discuss with your doctor some of these options and the supplements you can kind of see there. That, and all of these supplements too, actually, people even recommend for looking at if you do get sick with COVID-19 or even prevention of it. So these are antioxidants, especially things like glutathione. I take liposomal glutathione for neurological help all the time. So it's part of my routine, and they've seen studies related to antioxidant benefits of glutathione for respiratory infections as well. So these are all things to just go and talk to your doctor about. I'm familiar with most of this stuff because it's involved with the Bredesen protocol and just even with MS, so with Dr. Terry Walls. So definitely take this. Remember, sleep is always important. So if you can get sleep, so that's why some of these things include melatonin, to try to see if there's supplements in there that you might need when it comes to just making sure you get all that you need before you consider the vaccine, or just helping for prevention, I guess, with trying to protect you from COVID-19 infections.
Yeah, definitely. You're right, Melissa. I mean, all those factors are so important to consider. So definitely the sleep, the exercise, the relax, and with the supplements that you were talking about, we also have to make sure that we know what we can and what we shouldn't. At one point in my after I was diagnosed, there's a lot of great supplements out there that I couldn't even get close to. So because I knew that, I knew what not to take, and I know what to take. So it is important that you also know that certain supplements could be good for somebody, not good for somebody else. So you need to make sure that you do understand and check to see what can and what cannot help you.
Well, and I think that's part of the preparation, right? So, I mean, I think there's so many levels of preparation we can even consider right now. And you know, please, we're trying to be honest with all of you, and hopefully, like with your provider and having these discussions, you don't get dismissed. But even having preparation kits, like we talked about preparing if you're going to go get the vaccine, prepare with your provider in advance. What are things that are going to give you the best outcomes for getting the vaccine? So talking to your doctor if you might need an extra prescription for what that comes up, you know, what may come up with that, or also having a prepared kit in advance for getting infected with COVID-19. Because with autoimmune conditions and not building up the antibodies regardless, and how transmissible this variant has become, it might be time to just have that discussion so they know that you're just prepared. And I mean, I hope the provider doesn't dismiss you as like, don't worry so much, but you're just having this preparation. Okay, so what can I do? What's my outreach protocol if I do get infected? So that way there's a peace of mind. And like Juana said, maybe what, you know, medications, but also supplements could I have on hand that would prepare me for this. But you're always like, you're kind of just preparing ahead of time. And we talked about too, food. If you're going to get the vaccine, make sure it's like, you know, you can prepare in time, because a lot of people got knocked out. I'm really impressed by the people that didn't. But, you know, have this prepared in your fridge, like already vegetables or a smoothie packs that you can just throw in the blender and just drink the smoothie, or things like bone broths, like, you know, pre-made. So that way, if you aren't feeling well, you just drink it and you have it ready for you.
Yeah. Rosemary says, yes, totally, 100%. Thank you, Melissa.
Well, I'm all about prepping people, because, and just remember too, is like, regardless of what, try to decrease your sugar. I mean, this is what I've been emphasizing with people. Processed sugar lowers that immune system response. That is not something you want. So start
Mhm.
researching some things with, that you like. I mean, there's some really good resources, but maybe have that on hand.
Yeah.
Do you think, I mean, were you able to, like when you got sick with COVID-19 or even the vaccine, Juana, were you able to get those resources or were those difficult?
The resources as far as the food, you mean?
Yeah, or just cooking, or what did it feel
Well,
like?
uh, I when I got sick, one of the things, I mean, the only thing in my mind was, am I gonna make it for, I mean, for tomorrow? I mean, that was the thing. So, what I did, I was eating a lot of soups, a lot of soups. I would sometimes order to get it delivered to my home. My husband and I were sick. My older son wasn't, but he was completely we were isolated, but he was not even close to us. So, yeah, I had access to the foods, but one thing that I absolutely did for myself and my husband, I would go to the kitchen and make teas with you name it. I would just put in my teas, and I was drinking teas all day long. I never stopped, even if I didn't want to. I was forcing myself to have a warm tea. I did have Tylenol a few times, Dayquil as well. Other than that, oh, and the medication that my doctor prescribed. I mean, I think I did pretty good as far as having whatever I needed to have close to me on hand so that I wasn't, left without food or without nutritious, good food for me. But definitely I did. Rosemary is saying that she takes ZZZ quill to sleep and it helps her. It helps her good, and it's a non habit forming, and it works
Okay.
great. She says. But yeah, I guess I mean for me, I was able to have what I needed.
Well, I mean, that's important too. And if anyone's on their own or living by themselves, like I encourage you to actually have some sort of preparation kit or have these conversations with your provider too. Because I do know that some people were getting the vaccines on the weekend, which sounds good in theory, but then trying to reach your provider on a weekend was very difficult. So, especially if you're having a little bit of an extra response and you don't want to go into the ER, so those are things to actually consider and think ahead of time. So especially if you're by yourself, and you're living by yourself, and these are things to factor in. And I would encourage everyone to have some preparation kit or some kit ready to go at least, so you don't feel stuck or stranded. Because I know you can maybe order fast food, but that might not be the most nutritious way to go. Or like Juana said, soups, maybe start coming up with some soup recipes, or they have those like good bone broths or teas. You can
Mhm.
always stick maybe some unflavored collagen protein in those teas, or just getting all there's different teas too, if you know.
Mhm.
I think we all have to talk to our grandparents, right? Because they have all the
Definitely.
nutrition of soups, right? Because your mom has all those recipes, right? Right, Juana?
Yes, absolutely. I love soups, so for me it was easy. And sometimes a lot of the times we think about, like you said, bone broth, or I did not have meats, but I did have a lot of vegetables. I always have a lot of vegetables. I have garlic, I have ginger, I have onion. So my teas were basically with ginger, onion, garlic, cinnamon. So that's something that I always have. So it was easy for me to just put that and make it into a tea. As far as foods, yes, I vegetables and good nutritious things that I have in my fridge regularly. So I did not have to go out and purchase anything. I had everything at home, so I was able to manage um, the time that I had to be quarantined to be able to eat. And yes, here and there I would order soups, but I tried to get the soups that weren't bad for me, I would say.
I'm just only noting it's for people to watch the processed sugar, because some of the things that are touted as things with electrolytes aren't exactly electrolytes because they have a lot of sugar over that. So,
Yeah, no, no, no. No, for me, it was made basically water and the teas without sugar. Oh, actually, what I did use was honey.
Okay, that's different though.
Yeah, the real honey. So it was sweet, but it wasn't the sugars that I was having, no bread and any of that. So I did not lose weight, but but I think that's what really helped me with um, keeping hydrated and making sure that I was hydrated with water, teas, no artificial flavorings or sugars or any of that.
Yeah, like more of the processed sugar. So like
No,
honey is
no.
great benefits for health and I mean things like manuka honey and those things. So I mean it's a little different for what and even in Chinese medicine they really feel like fighting this off. You've heard the discussions probably in social media of using hot to like actually battle this. So always keep warm things in your system. So I don't know if anyone's noticed that at all out there. But like the soups and the teas and stuff like that, I've heard earlier on there was a lot of good response with that. I wish I could have garlic, but they talk about like even that apple cider, the fire cider with all the garlic in there and it's potent. Dr. Walls mentioned to like do all that with the apple cider vinegar and garlic in there with get your system going and get you sweating too. Sweat out the whole thing. So
Mhm.
it's all different research of what you do, but most of all is just making sure people can, just like I said, have a prep kit, have a conversation with your provider. Like these are things that you're concerned about. So
Mhm.
you'd like to just kind of have something there prepared in advance. You're not overthinking it and just acknowledge that there's a lot of confusion right now and you're trying to do the best that you can to take care of your health.
Right. And I'll read something else that Rosemary. Thank you, Rosemary, for having interacting with us and sharing information to us as well. She says everyone needs to know that OTC and flu medicines, including multivitamins, are running out everywhere. Just like the first time when COVID-19 started. So please stock up now before everything runs out.
Oh no. So it's starting to happen again, which we talked about in our other
Yeah.
community connects as well. So I mean, this is where if you can prepare, you don't have to like hoard.
Right.
Um, but
Right.
definitely, I mean, this is where our communities got stuck last year and just even be able to afford, I mean, not even toilet paper, which was just really difficult, but I mean, hand soap,
Mhm.
shampoos, just laundry detergent, like all these things you might not think about because it was difficult and challenging for people to get because trying to get out. So I had heard from a lot of people last year they were rationing even laundry detergent and stuff, and this is definitely a time to be clean, take, have the hand soap available. So I'm not happy that the medications are once again flying off the shelves, but I guess maybe that's why it's a good time to just prepare and have there. If you did prepare last year, take a look at your expiration dates, go back through and just kind of take a look at what you have in your supply stock. If you have kids as well, what do they need? What does the family need as far as kits go?
Definitely, like you said, not whoring, but just making sure that you have enough. And because, there's a lot of other people who may not be able to get what they need right now. And we also need to, try to be sensible and think about the ones that aren't able to afford or they're unable to get that kit together, that when they do get sick or they do need it, that there's also some for them because we have to think about everyone.
Oh, I know, especially people that can only do it month to month or don't have
Mhm.
enough to actually buy ahead his plan
Right,
or even coverage. Like some of the stuff doesn't cover laundry detergent and those products because it's more food based. So,
right,
I mean,
right.
there's a lot of things to consider.
And also, like you said, Melissa, about the expiration dates. I mean, we can have 100 boxes of any item, and we might not be able to use it because of the expiration date. So we also have to think about that. So I think just um, being sensible and get what you need, prepare, but don't overdo it.
Definitely. And I mean, before we close it out, I had forgotten that we included some links because this is an interesting discussion that isn't taking place is like for autoimmune conditions. I mean, they've been talking about boosters, for the immunocompromised because they're not building up antibodies, but they're seeing the third shot. So, but this raises a lot of questions for people. And again, I'm not a medical provider. These are just like topics that, I would love to hear talked about more in our communities, is even the idea if how the difference would be, and stuff I'm curious about is trying to even get the child's dosing for autoimmune conditions, potentially because the lower dosing to have less of an immune response. Or I put an article in there what they did for people who had an allergic reaction. They tested it with a graded dosage response, which we've seen with other vaccines in history, is they have a graded dosing. So like small dosages. And I think they do this with allergy testing too. So it's little small dosages that they are talking about. So your immune system doesn't have this huge spike of a response, but it's a graded dose. So you're still trying to get the protective benefits, but you're getting it in a milder dose each time to build up that immune system response to whatever they've had in the vaccine. But I'm not hearing any discussion about that. I just saw it in a form of like people who have allergies to the ingredients, that they're kind of grading the dosage. But I'm like, why aren't they talking about this with like autoimmune conditions as opposed to giving us just a full dose booster? I'm like, well, there is the child's dose out there too, which is a lower dosing. But we included articles to that if anyone's interested, or if anyone has more information on that, or has a provider that's actually talking about that. I would be fascinated to talk to them when it comes to that.
Definitely.
And I definitely see some more questions coming in of this hesitancy with the vaccine. I want to honor that too, because we aren't getting good information on the vaccine, and it doesn't make you a certain category of like, you're not a bad person. We are just confused.
Really. And again, I mean, everyone has a choice, a decision to make, whether they should or they shouldn't. Just making sure that you're informed and know the good things and the bad things about the vaccine. For me, again, the reason I got it is because I've had many people that I know, including a family member who has passed away from COVID, and I did not want to risk and having COVID or had COVID. It was not a good feeling, so I decided to get the vaccine. But everyone should, do their own research, make their own decision as to whether to get it or not.
Right. And then understanding, I mean, we are higher risk populations. So just making that clear, even for fibromyalgia, because we don't know where we exactly fall with the immune system. And I think it needs to be put out there more often as far as that. So that's why we're stuck. And I mean, there are conversations about that. Like, we are in the high risk when it comes to COVID-19 infections and the severity that can happen with our communities. But then at the same time, it's not being addressed that like what to exactly do with this. So are we getting the protective benefits we need from the vaccine? And of course, we're seeing the vaccine with what's being told to us is decreases severity of impact for COVID-19. So that's where it's like risk versus, we don't want to risk having a high impact of being infected, but that's where the vaccine could come in. And we have seen on the fibromyalgia side, I mean, I know it's really different with lupus because everybody has those inflammatory markers. But again, on the fibromyalgia side, I mean, from that Health Rising, there were side effects for people. Some people feel better, which I really want to know more about after taking the vaccine. But I think there were, I mean, we're getting through this as much as we can. So hopefully that helps a little bit when it comes to that. It looks like the fibromyalgia community is having less kind of reactions to the vaccine, but we don't have a full population study. That's the problem.
Right.
So we need more information, and people doing these surveys or studies out there. If you're out there and listening, please definitely reach out. We would love to hear from you and get more information, because we need more updated information, especially as this Delta variant comes through. And there will be other variants. We've heard about them, like Lambda variant, Theta variant. I don't know which is going to become the prevalent one, but Delta right now is the forefront. And so it's still early, but our chronic illness community is definitely, we need more information so we can educate and do a better job of talking to all of you. So
Definitely. We definitely need more information.
So thank you, everyone. I mean, if there's nothing else to add, Juana, we can close it out with everyone here. And
yeah, I don't think, we can definitely go on for hours. I mean, if we could start, coming up or talking about other things as to the COVID or the Delta variant. But yeah, I think that I think this for now would be okay.
yeah, I mean, Juana and Estella know I can talk for hours about science and get into more details of the variants, but I don't think that, I'm not sure, maybe that's a separate time in a separate group if people are interested in understanding more of virology. Because when this first started, I definitely dusted out my virology books from college, dove into all the science and details. So I've been studying everything that has been kind of published in the last 15 months on COVID-19, and especially learning more about the variations for what's happening here. So for everyone out there, just please just, take the precautions that you need to protect your health, talk to your providers, prepare, get a preparation kit. And if you have any questions, definitely reach out. We did put a lot of links in there. There's a lot of information that you can bounce around, but if you need some more clarification, we are here to help as best as our ability. I wish we had some more providers that could help us answer these questions for sure, but we tried to dive into the education as much as we can.
Well, thank you everyone for being here with us. Thank you, Rosemary. Thank you, Ricardo Flores, and I believe there's other.
Yeah, and Mary, Marcy, thank you for joining us. I mean, Marcy, I know there's a lot of information at the beginning of this video, but if you have more questions, just let us know on the fibromyalgia side. So we definitely put some links in there that could help with decision making as well.
Definitely. Thank you.
Thank you, everyone. Have a great weekend. Happy Friday. And we will see you, I guess. Wait, before you go, Juana, you and Estella have an event tomorrow. It's local though, right?
Yes, we're going to be having an event. It's a mental health walk tomorrow in the city of Baldwin Park. We're going to be having a booth. It's at I believe it's it's on Main. It's at the adult school in Baldwin Park in Maine. That's where our booth is going to be. But there's going to be a walk with the mayor. We're going to be walking alongside with the mayor. And we're just going to be providing resources, information as to lupus, fibromyalgia, and mental health. So please, everyone, if you have time and if you want to join us, we will be there tomorrow starting at 8 a.m. till 1 p.m. And there's going to be other booths where you can get information as to mental health and other information. So yes, I invite everyone to join us.
Well, I haven't even been out of my house to even join you guys.
Yes, we are going to be taking all the precautions, so we do need to make sure that we all wear our face masks, and we do have that distancing. And so definitely, yeah, this would be our first event where it's going to be an in-person event. So we are a little nervous, but we're hoping for the best. And again, just taking all the precautions, making sure that the distancing, the wearing the masks, and making sure that we wash our hands or we have the hand sanitizer. So
yes, please, everyone, keep up with the public health of just making sure you wash your hands. It's still very relevant. Do not touch your face. I think I told everybody, I ran into CVS, and if you have lash extensions, please don't keep touching them in public. I was gonna take the lady's hands and be like, please don't touch her face. She's all standing there I was like, oh, with her dirty hands, she had just touched, she's touching the cart as she was going around in CVS and touching everything. And then she's like, I was like, oh.
Absolutely. Yeah. Don't touch your eyelashes.
I saw rubbing to get our compact. I was like, what is going on? I was like, okay, let's, if you have the autoimmune condition, you have a significant other, you're not going on a date or anything like that, or you're not going to a job interview, you guys are beautiful without all of that right now. Like,
Right, definitely.
your health is
Whatever.
more important.
Yeah, Barbie says glasses stop us from doing that. Absolutely.
That's why I put a face shield over. I'm
Yes,
like,
don't do
oh,
that. Right?
but I mean, she did it multiple times, so I was just caught it multiple times. So I was like, don't touch your face.
Melissa, you were stressing. I was like, oh no, what is she doing?
It was more of me because everybody knows that I'm overprotective a little bit. So I'm over prepared, but we can have that as a separate conversation if we need to, of how maybe some of the preparation, we might need to have some upgrades if we have the autoimmune conditions, upgrades our masks a little bit more, what that takes to just make sure we don't get this Delta variant as well. But thank you everyone for tuning in. We appreciate you, and we will see you next time. Bye.
Bye, everyone.